guys, it's Dr. Jackson again from the Sports Pod. Today I want to bring you a quick little video and talk about ACLs. Now, we've been doing a mini series on ACL return to play protocols, but I want to back up a little bit and talk a little bit more about this very, very important structure. So, ACL stands for anterior cruciate ligament. It's a small structure in the knee. It attaches from your femur down to the top of your shin bone, and what it does is prevents forward movement of the shin bone or your tibia in relation to your femur. So there's a few things that make you more at risk for having an injury to this structure. One of those is going to be gender, so whether you're male or female. And oftentimes females have a higher incident of injury to this tissue, and some of that's just because they don't have as well developed muscles in their lower leg, such as the quads and the hamstrings. They also usually present more with what we call knock knees, or valgus stress to the medial part of your knee. So, oftentimes an ACL injury is what we consider non-contact. So, you may be running or sprinting and then you come to an abrupt stop. You may be pivoting on one leg, putting all your weight there, shifting and going in the opposite direction, or striking a ball. Oftentimes it's not when you're getting bumped by another player in a contact type situation. So, like I said, oftentimes it's from an abrupt stop or an explosive maneuver. So what happens generally is the quads are activated at a very high percentage of their capacity. And so when you're running and right before you basically strike your foot on the ground or you heel strike, you have a very slight bend in the knee and the hamstrings are essentially non-existent. They're activated but not very much so. So you have this giant imbalance between quads and hamstrings. And then when you plant and you go, basically those quads put too much stress on the ligament, and then you either tear the ligament or strain the ligament and you have an injury to your ACL. Now, you may be wondering, how do I know if I have an ACL injury? Well, oftentimes you'll hear a pop or a snap or a click, and this may be followed by pain. You may get some swelling, but not all the time. You may have trouble ambulating or walking, bearing weight on that leg. If you're experiencing any of these symptoms or you're not sure if you have an injury to your ACL, go ahead and get this checked out by a proper healthcare provider so that they can give you some insight as to what's going on and get it taken care of properly. Once again, my name is Dr. Jackson from the Sports Pod. I'd love to hear from you. If you have any questions, feel free to contact me via social media. It'll be down here in the left. If not, move free.